Hello friends, 10th October is celebrated as a mental health day. So it is really a new way of thinking, a new thought for many of us. And what is the role of mental health in the prevention, treatment and control of psoriasis? So, what is a mental health? Mental health means if you are feeling joyous, if you are enthusiastic, if you are confident, and if you are happy, that is the sign of your mental health. But on the other hand, if you feel sad, if you feel depressed, if you don't feel like mixing to the people, if you want to be alone, if you feel sad, if you have an anxiety, if you have a fear, all these are the signs of you are not healthy. These are the signs of mental disorders. Mental disorders does not mean directly that you go mad. This is the biggest misunderstanding in the people, that going mad is the mental disorder. No, mental disorders are these things when you feel depressed, when you feel fear, when you feel suspicious, when you suddenly get an anger unnecessary, when you cannot control your anger, when you cannot sleep, when you cannot enjoy your food. So all these things are called as the mental disorders. And in these mental disorders, if it continues for a long time, it can go to the pathological state and you may have to go to the psychiatrist and take a treatment. Of course, there are psychiatric disorders when suddenly someone loses his mind and he has to take to the doctor. But that is the disease, the full-fledged disease. But the minor signs are there, and to be very frank, everybody is noticing all these things. So, do you think every time you need to go to the doctor, you can manage it yourself? Like, if you take a proper food, proper diet, you can manage your health. If you do proper exercise, you can manage your physical health. Like that, you can manage or you can nourish your mental health also. But in case of psoriasis, it has been found that all those patients who come up with psoriasis, they do have a trigger factor. It has been found that their mental health was not good for considerable time. They were stressed, they were depressed, they had insecurity, they have fear, they have emotional setbacks, and after that they got psoriasis. So this is one of the strongest trigger factors. So if you have a tendency of psoriasis, or if you have family history of psoriasis, or if you know about psoriasis, and if you don't want to get the psoriasis, be cautious about all these symptoms and work on it. Consult your doctor and help. You may not need the medicine, but you may need to improve your mental health by certain things that I will tell you at the end of this video. So far, the psoriasis, I told you that mental health disorders, it triggers it. And all those patients that we notice that who are undergoing our treatment. So what happens while undergoing the treatment? Suddenly something happens in their life. They have some stress, they have some anxiety, they have some restlessness, emotional setback, love failure, etc. Suddenly their psoriasis shoots up. So, if you are taking a treatment for homeopathy or any pathy in psoriasis, you have to improve your mental health. That will help you the medicines to work better. And prevention of the psoriasis, the role of mental health in prevention of psoriasis. So, how you can prevent it? If you are aware of all these mental health, improving or nourishing mental health, or all these signs that when you are going to your mental health is running down. So what are those? That getting irritability, getting anger, or you are restless, you cannot concentrate, you cannot sleep well, your sleep is disturbed. So all these things are the early signs of disorders of your mental health. So if you have it, improve it. If you are having a tendency of psoriasis, by improving your mental health, you can delay the psoriasis, or you can even may not get psoriasis if you do that. And last but not least, I will tell you how you can improve your mental health. Number one is that you should have a positive mental attitude. You should accept the thing. That is called as mindfulness. That is, you accept the thing as they are, and don't try to worry much or don't try to think much about future. Accept the things as it is. Try to manage them. And very important thing, you need to have good, in order to have a good mental health, you should have a good physical health. And in order to have a good physical health, you have to eat at the right time, eat the right food, drink a lot of water, do exercise, physical exercise, go in nature, walk in nature, and have a good sleep, and have a proper sleeping time. Minimize your gadget 2 hours before going to the bed, don't use them. Read books, talk to the friends, laugh, make jokes, spend your time with the family, spend your time with the friends. Whenever you have some time, you go out in the nature, move in the nature. So do all these things, freedom, to become happy, so that you will be happy, and that will improve your mental health. So if you do all these things, and last but not least, I'll say yoga and meditation. Meditation means simply sitting and relaxing your mind for 10 minutes a day, and just observe your breath, observe the things around. Try to be relaxed with your mind and just observe your thoughts. Gradually, you will be thoughtless, and that relaxation will improve your mental health. That is what called as mindfulness or mindful meditation. So this mental health is very important before going to your doctor. Definitely, if you work on it, and there are a lot of videos, a lot of people will help you about improving your mental health. Thank you.